Welcome to Kinvent Talks, where science, clinical expertise, and patient care come together. In this episode, we're exploring the power of evidence-based practice in physiotherapy and sports medicine, shifting from subjective assessments to objective, data-driven decision-making. We'll break down the core principles of EBP, including how to integrate scientific research, clinical expertise, and patient preferences to optimize treatment outcomes. From diagnostic and prognostic studies to evaluating research quality, reliability, and validity, we'll discuss the essential tools and methods, like those from Kinvent, that help bring EBP into real-world practice. Whether you're a clinician, researcher, or healthcare professional, this podcast will equip you with the knowledge to enhance patient care and advance physiotherapy through a data-driven, patient-centered approach. So, let's dive in and bridge the gap between research and practice.
Today, we're really diving deep into evidence-based practice in physiotherapy.
Ooh, exciting.
Yeah. And we've got this fascinating white paper to kind of guide us through it.
Okay.
And you're here because, well, you want to know how this whole EBP thing is, changing physiotherapy.
Yeah.
Think of it like we're moving from, my knee feels kind of wonky, to a more precise and data-driven approach.
Yeah, exactly. We're trying to move beyond just like subjective feelings and intuition and moving towards more objective measures and, treatments that are backed by evidence.
Yeah, and so this white paper really emphasizes that. And what I think is cool is it digs into how this impacts like everything from how physiotherapists diagnose and treat to how the patient experience care and how well those treatments work.
Yeah. So the core concept here is really evidence-based practice, or EBP.
Okay.
And it's about weaving together the best available research that we have with the clinical expertise of the physiotherapist. And also, really importantly, is the individual values and preferences of the patient.
Okay, so I'm already seeing how this is different because it's not just about, blindly following the latest study that you read about.
Right. Yeah.
We all know someone who's, tried some trendy workout routine just because they read about it in a magazine.
Exactly. Yeah. A good physiotherapist brings years of experience and their skills and that kind of art of physiotherapy to the table as well.
Right.
But here's where it gets interesting, is that expertise is combined with, but not replaced by the latest research findings.
That makes sense.
Yeah.
So let's break down these 3 pillars of EBP that you've mentioned.
Yeah.
You mentioned clinical expertise.
Yeah.
Can you give me an example of how that might actually play out in practice?
Yeah. So imagine a patient comes in and they have this really unusual set of symptoms that I haven't seen before. And there's no research paper that I can find that tells me how to treat this specific case.
Right.
This is where my experience and observation skills come in. So I would assess them, look at their medical history, and use all of that information and my knowledge of like anatomy and biomechanics to try to formulate a plan.
Okay, so it's not just about textbooks and studies. It's about applying that knowledge to real-world situations.
Exactly. And while my experience guides my initial approach, I will also be simultaneously searching for relevant research, and maybe even reaching out to colleagues to get their insights as well. So it's really a dynamic process, and it's constantly evolving.
Yeah, that makes a lot of sense.
Yeah.
Now, what about the patient's values and preferences? How do those fit into this?
Yeah, so you have to think about that everyone comes to physiotherapy with their own baggage or beliefs about health and healing, and even some skepticism.
Oh, absolutely. Some people might swear by certain exercises and others might be terrified of needles.
Yeah, for sure.
Or had a bad experience with physiotherapy before.
Yeah, exactly. And those things really matter. A good physiotherapist takes the time to understand the patient's perspective, address any concerns, and really explain things clearly.
Yeah.
It's about building trust and making sure that the patient feels heard and understood.
And I'm guessing that makes it more likely that they'll actually, stick with the plan.
Exactly. When they feel like they're part of the decision-making process, they're more likely to actually be invested in their own recovery.
Right. Okay, so we've talked about the clinical expertise and the patient values.
Yeah.
Let's dig into that 3rd pillar, clinical research.
Yes.
Now, I have to admit, as someone who's not a physiotherapist myself, the research out there is overwhelming.
For sure.
How do you, as a physiotherapist, even begin to navigate all that information?
Yeah, it can definitely feel daunting.
Yeah.
It's about knowing where to look for reliable information and how to actually critically evaluate the quality of the research.
Okay, so let's talk about that critical evaluation, because how do you determine if a research study is reliable? I'm picturing myself scrolling through online and just looking at all these studies
No,
and trying to figure out what's real and what's not.
Yeah, it's like trying to find a reliable source of news in a sea of clickbait.
Yes, exactly.
When we talk about reliability in research, we're looking for consistency in the results.
Okay.
So let's say a study's using a goniometer to measure someone's range of motion.
Mm-hmm.
We want to make sure that that goniometer is producing consistent measurements every time it's used.
Yeah.
Even if different clinicians are using it.
So if I was using a goniometer and getting like wildly different readings each time, I'd know something was off.
Exactly.
It would be like using a wonky bathroom scale that shows you 5 pounds lighter 1 minute and 10 pounds heavier the next.
For sure, we need reliable tools and consistent data if we're going to draw accurate conclusions.
Okay, that makes sense.
Yeah.
So reliability is about consistency. What about validity? Is that kind of like the research equivalent of making sure that you're getting your information from a credible source?
Yeah, kind of. Validity is about whether a test or a measurement tool actually measures what it claims to be measuring.
Okay.
So it's making sure that we're using the right tools for the job.
Okay.
And that those tools are accurate.
Can you give me a specific example of how validity might play out in physiotherapy?
Yeah, so let's say a study is trying to assess how effective a new exercise program is for improving balance in older adults.
Okay.
If they use a test that primarily measures leg strength instead of balance,
right,
that study wouldn't be very valid.
Yeah.
The tool isn't accurately measuring what it's supposed to, so the results would be misleading.
So the test needs to be a true reflection of what they're actually studying.
Exactly.
It's like using a ruler to measure temperature.
Yes.
The tool and the measurement just don't align.
That's a great analogy.
Okay.
We need to make sure our tools are both reliable and valid to make sure we're building our treatments on solid evidence.
Yeah, this is really helpful in understanding how physiotherapists approach research.
Yeah.
The white paper lays out a 5-step process for implementing EBP.
Yes.
Seems very structured, which I appreciate.
It is.
Can we walk through those steps?
Absolutely, and let's do it.
Okay. Step 1 is ask a relevant question.
Okay.
That seems pretty straightforward.
Yeah.
But I'm guessing there's more to it than just, does your shoulder hurt?
Yeah, you're right. It's not just about identifying a problem.
Mm-hmm.
It's about framing a very specific answerable question using what we call the PICO format.
Okay, PICO. I'm intrigued. What does that stand for?
So PICO stands for Population Intervention, Comparison, and Outcome.
Okay.
It helps us zero in on the key elements of our question.
Okay.
So, for example, instead of asking, does exercise help with lower back pain? We might ask, in adults over 60 with chronic lower back pain, is yoga more effective than traditional physical therapy exercises in reducing pain and improving functionality?
Wow, that's incredibly specific.
Yeah.
I can see how that would help narrow down the research.
Exactly, and that's what step 2 is all about.
Okay.
It's conducting a literature review. So we use those keywords from our PICO question to search databases like PubMed, the Cochrane Library.
Okay.
And we try to find studies that directly address our question.
So it's like going on a mission with your keywords as your compass.
Yeah, I love that.
Okay.
But the journey doesn't end there.
Yeah.
Once we've found some promising studies, we put on our detective hats for step 3.
Oh.
Critical appraisal.
So now we're examining the evidence.
Exactly. We need to really carefully evaluate the quality of the studies.
Okay.
We look at the study, design the sample size, how they controlled for bias, the statistical analysis, all those details that tell us how much weight we should give to the findings.
Now, there are tools to help with that, right? Because that sounds like it should get very overwhelming very quickly.
Yeah, for sure. It's not just about like skimming the abstract and calling it a day.
Right.
So we use tools like the Pedro scale or the Cochrane risk of bias tool to really systematically assess the quality of that study.
So it's not just about finding a study that seems relevant.
Yeah.
You really have to dig in.
You do.
And make sure that it's, high quality.
Exactly. We want to make sure that we're basing our decisions on solid evidence.
Okay, so we've asked our question, we've searched for studies, and we've critically appraised the evidence.
Yes.
What's next?
This is where it all comes together.
Okay.
This is step 4, synthesize and implement.
Okay.
We take all the evidence, our clinical expertise, the patient's needs and values, and we create the best possible treatment plan.
Wow. So it really is this beautiful integration of knowledge and experience and patient-centered care.
It really is.
I can see how this would lead to much more personalized treatment plans.
Absolutely.
Okay, so then as we're implementing the plan, we're observing the results, and that takes us to step 5.
Yes. Step 5, observe and assess the results.
So now we're putting it into action and tracking how they respond.
Exactly.
Okay.
We use a combination of objective measures, like strength tests, range of motion, and also subjective feedback.
Okay.
So like pain scales
right.
and how they're feeling overall.
So it's getting both sides of the story.
It is.
So I can see how that step really closes the loop.
Yeah.
And ensures that the plan is really tailored to the individual.
Exactly.
That's great.
It's making sure that the treatment is effective and helping them achieve their goals.
This 5-step process really highlights how much thought goes into EBP.
Yeah.
And I'm understanding why it's becoming so important in physiotherapy.
Yeah.
It's about making sure that those treatments are based on the best available evidence and tailored to the individual patient.
It really is.
Yeah.
It's moving away from just anecdotal evidence and tradition and moving towards this more rigorous, evidence-informed approach.
Now, the white paper goes on to kind of delve into specific types of research that are relevant to physiotherapy.
Yeah.
Can we explore those a bit?
Absolutely. Let's start with diagnostic research.
Okay.
So this type of research really focuses on accurately identifying what's causing the problem,
Okay.
which is essential for effective treatment.
So it's all about figuring out what's really going on so we can target the right treatment.
Exactly.
Okay. And so there are some important concepts to understand here, like sensitivity and specificity.
Yeah.
So think of it like sensitivity is about how good a test is at correctly identifying those who actually have the condition.
Exactly.
So a highly sensitive test would be good at catching all the true cases and minimizing those false negatives.
Yes, exactly.
Okay, so then specificity is how good a test is at correctly identifying those who don't have the condition.
Exactly.
So a highly specific test would be good at weeding out those who don't actually have it and minimizing those false positives.
Yes, it's like a spam filter for your email.
That's a great analogy.
We want tests that are both sensitive and specific.
Right.
So we can be confident in the diagnosis.
But what happens if a test is not very sensitive or specific?
Yeah, then things get a little bit trickier.
Okay.
We have to consider the implications of both false positives and false negatives.
Right.
So, for example, let's say we have a test for a knee ligament injury that's not very sensitive.
Okay.
We might miss some actual cases, which could lead to a delayed diagnosis and treatment.
And on the flip side, if a test isn't very specific, we might end up diagnosing people who don't actually have the condition.
Right.
And that leads to unnecessary intervention.
Exactly. It's a balancing act.
Yeah.
And that's why choosing the right test is so important.
Right.
It's not just about ordering every test under the sun.
Yeah.
It's about using tests wisely,
Okay.
understanding their limitations, and interpreting the results in the context of everything else that's going on.
This is really helpful in understanding how those decisions are made.
Yeah.
Now, the white paper mentions these receiver operating characteristic curves or ROC curves.
Yeah, ROC curves.
Yeah.
They're basically a visual way to represent the accuracy of a test.
Okay.
So imagine a graph, and we plot the true positive rate, which is the sensitivity, against the false positive rate.
So it's a way to see how well the test is performing.
Yeah.
Both at catching true cases and avoiding false alarms.
Exactly. The shape of the curve tells us a lot about the accuracy of that test.
Okay.
Ideally, we want a curve that goes up and to the left,
Okay.
which would indicate high sensitivity and specificity.
So a curve that's more like a straight diagonal line would indicate a less accurate test.
Exactly. It would mean that it's essentially a coin toss.
Got it. Okay.
Yeah.
I'm starting to see how these curves could be a really powerful tool for visualizing the data.
Yeah, they are.
So moving on from diagnosis, what about prognostic research? How does that fit into the picture?
Prognostic research is all about predicting the likely course of a patient's condition. It helps us to understand things like how long recovery might take, what the potential for limitations might be, and the likelihood of any future complications.
So it's about managing expectations and setting realistic goals.
Exactly. It's understanding the potential trajectory and providing the patient with a realistic time frame.
So, for example, if someone comes in with a rotator cuff tear, prognostic research can help predict the likelihood of them regaining full range of motion or returning to their previous level of activity.
Yeah, I see. So it's about looking ahead and understanding the potential outcomes.
Exactly.
Now, the white paper mentions using these multivariate models in prognostic research.
Yes.
Can you explain what that means?
Yeah, so multivariate models basically combine multiple factors to make a more accurate prediction.
So, for example, when we're predicting recovery time from a hamstring strain, a multivariate model might consider things like the patient's age, the severity of the strain, their previous injury history, even their level of physical activity.
So it's taking like a holistic view.
Exactly.
Okay.
It's recognizing that recovery is influenced by this complex interplay of factors and using all of those factors to make more accurate predictions.
That makes a lot of sense.
Yeah.
Now, before we wrap up this part of our deep dive, I want to circle back to something that came up earlier.
Okay.
The importance of outcomes in EBP.
Yeah.
Can you elaborate on that a little bit more?
Of course. So when we talk about outcomes, we're really talking about the results of the treatment.
Okay.
It's about measuring how the patient is doing and whether the treatment is actually having the desired effect.
So it's not just about going through the motions.
Exactly.
It's about making sure it's working.
Yeah. And there are two main types of outcomes that we look at.
Okay.
Performance-based outcomes and patient-reported outcomes.
Can you explain the difference between those two?
Yes. So performance-based outcomes are objective measures.
Okay.
So things that we can directly measure like strength, range of motion, balance, functional capacity.
Got it.
Patient-reported outcomes are subjective.
Okay.
They're based on the patient's perception of how they're feeling, their pain level, their ability to do their activities, and their overall quality of life.
So it's about getting both sides of the story.
Exactly. Using both gives us a more complete picture of the patient's progress.
Okay.
It's understanding not only how their body's healing, but also how they're experiencing that recovery process.
That makes sense. Healing isn't just about physical changes.
Right.
It's also about how the patient feels and functions in their life.
Absolutely. We want our patients to recover physically, but also to feel empowered and confident in their bodies.
Yeah, this has been a fantastic overview. I think we've laid a really solid foundation for understanding the key concepts.
Yeah.
We'll be back in just a moment to continue our exploration of EBP.
Sounds good. And we're back ready to dive even deeper into EBP.
Okay, so we've covered a lot of ground already, but I'm curious about how this translates to real benefits for patients.
Yeah, that's a great question.
Like, what does EBP actually mean for someone who's going through physiotherapy?
It's one thing to talk about research and methodology, but it's all about improving the patient experience and helping them get the best possible outcomes.
So how does EBP actually lead to those better outcomes?
Well, first and foremost, EBP helps ensure that we're making accurate diagnoses.
Okay.
Remember our discussion about diagnostic research sensitivity and specificity?
Yeah.
When your physiotherapist is using EBP, they're drawing on the latest research to choose the right tests and interpret the results correctly.
So it's about minimizing the false positives and false negatives, making sure we're not missing anything important or treating something that's not actually there.
Precisely. And once we have an accurate diagnosis, EBP helps us choose the most effective treatments.
Right. So we're not just relying on tradition.
Exactly. We're using treatments that have been scientifically proven to work.
Okay. So it's about, increasing the odds of success by using treatments that have a good track record.
Exactly. But it goes beyond just choosing the right treatment.
Okay.
EBP also emphasizes clear communication and shared decision-making.
I like that it's about involving the patient in the process rather than just handing them a sheet of exercises.
Absolutely. When physiotherapists explain the evidence behind their recommendations, it empowers patients to be active participants in their own recovery.
And I imagine that shared understanding makes it more likely that they'll stick to the plan.
You're absolutely right. When patients feel heard, understood, and involved, they're much more likely to be invested in their recovery.
This makes sense. It's not just about the technical stuff. It's about building that relationship.
Yeah, it's about seeing the patient as a whole person.
Right.
Not just a collection of symptoms.
Okay, now I want to shift gears a bit and talk about technology.
Yes.
This is something that's really captured my imagination.
I know
The white paper briefly touches on how technology is changing the game.
Yeah.
But I'm curious to hear your thoughts on this.
It's an exciting time to be in physiotherapy.
Yeah.
Technology is opening up so many possibilities for enhancing the way we practice EBP.
Like what kind of possibilities?
Well, think about wearable sensors that can track your movement patterns,
okay,
apps that provide personalized exercise plans, and even virtual reality tools that can be used for rehab.
So it's like EBP is getting this high-tech makeover.
It really is.
Okay.
It's about using technology to gather data, tailor treatments, and even make physiotherapy more engaging and accessible.
Can you give me like a specific example of how this might play out?
Sure. Let's say someone's recovering from a knee injury.
Oh, okay.
Traditionally, we might assess their range of motion just by looking at them or using a goniometer. But now we can use wearable sensors to get real-time data on their joint angles, their movement patterns, and even the forces they're generating.
So we're going beyond just like what the human eye can see and getting a much more detailed picture.
Yeah, and that data can then be used to create personalized plans, track their progress, and make adjustments.
So it sounds like technology is allowing us to be more precise and maybe even more proactive.
I think that's a great way to put it.
Okay.
It's about using technology to empower both the clinician and the patient.
Now, I want to address something that I think is important for our listeners to know.
Okay.
The white paper that we're discussing is sponsored by Kinvent.
Yes.
A company that develops devices for physiotherapy. So does that sponsorship in any way influence the information?
That's a great question.
Yeah.
Transparency is so important.
Yeah.
While Kinvent did sponsor the white paper, it's important to note that they don't explicitly promote their products.
Okay, so it's not like a thinly veiled ad?
No. Not at all. The focus is really on explaining EBP and how technology can facilitate it.
Okay.
They use Kinvent as an example, but they don't go into the specifics of their products.
Okay, good. I'm glad to hear that.
Yeah.
Because it keeps things objective.
Yeah.
And we can focus on the core concepts.
Exactly.
Now, before we move on, I want to bring up something that the white paper doesn't really address. Continuing education.
Yeah.
It seems like physios need to stay up to date on research to truly practice EBP.
Yeah, that's a really great point. You've hit on a crucial aspect that often gets overlooked.
Yeah.
It's not a learn it once and you're done kind of thing.
Right. It's a constant evolution.
It is. The field is constantly evolving. So to truly embrace EBP, we need to be committed to ongoing learning.
So what does that look like for a physio? How do they stay current?
There are so many ways. We can go to conferences, workshops, read journals, do online courses, even join peer groups.
So it's about actively seeking out those opportunities to learn.
Exactly.
Okay.
And it's not just about staying informed.
Okay.
It's about reflecting on your own practice and being open to new ideas.
Yeah. That sounds like a lot of work, but also very rewarding.
It is.
Right.
EBP is a journey, not a destination.
I love that.
It's about constantly striving to be better. And that requires ongoing learning and growth.
And I imagine that ultimately benefits the patient.
Absolutely. When your physio is committed to continuing education, you can be confident they're bringing the most up-to-date knowledge to your treatment.
Okay, so I think that's a great takeaway for our listeners.
Yeah.
The pursuit of knowledge and that commitment to learning are at the heart of EBP. We'll be back in just a moment for the final part of our deep dive.
And we're back for the final part of our deep dive into EBP.
Okay, so we've covered a lot of ground.
We have.
We've talked about the core concepts, the benefits for patients, and even the role of technology.
Yeah, it's been a lot.
But now I want to shift gears and talk about what this means for our listeners.
Okay, yeah.
Because whether you're an athlete or recovering from an injury, understanding EBP can really make a difference.
It can.
So let's kind of distill this down.
Great.
What are the essential things to remember about EBP?
Well, the first takeaway is that evidence-based practice is really revolutionizing the field.
Okay.
It's moving away from opinions and towards more rigorous approach.
And that translates into more accurate diagnoses?
Yeah.
Effective treatments, better outcomes?
It does. EBP helps ensure that we're using the best evidence to guide our decisions, which means you're more likely to get the most effective care.
It's also about fostering that collaborative relationship.
Absolutely.
Yeah.
EBP encourages communication, shared decision-making, and a genuine understanding of the patient's needs.
So it's working together as a team.
It is.
We've also seen how technology is really playing a role.
It's huge.
From those wearable sensors to the apps.
Yeah.
It's making it more precise, more engaging.
Yeah, and more accessible.
Yeah, exactly.
It's a really exciting time to be in this field.
It is.
The possibilities are endless.
Now, even if you're not a physiotherapist yourself, understanding EBP can make you a more informed patient.
Absolutely. Don't be afraid to ask your physio about the evidence behind their recommendations.
Yeah, ask questions, do your research.
Yeah, be involved.
Be your own advocate.
Exactly.
And remember, EBP is a journey.
It is.
It's a commitment to constantly learning.
Yeah. And as new research comes out, physiotherapy practices will keep evolving.
And that's a good thing.
It is. It means we're always trying to improve and provide the best care.
This has been a really insightful look into the world of EBP.
It has.
And I hope it's left you feeling informed and empowered.
Yeah.
If you want to learn more, check out the resources in our show notes.
Yes. Definitely check those out.
And remember, keep those questions coming and stay curious. Thanks for joining us on The Deep Dive.
Thank you for having me.